we're going to do an MET technique now for the rectus femoris muscle. This is a very important muscle for our anterior chain. It crosses two joints, crosses our hip and our knee. So when we apply a stretch or an MET technique, of course, we need to involve both of those joints. So the first part of this will be taking up the slack at the distal end of the muscle using knee flexion. Now that lengthens the tissue at one end, but we also need to get the hip extension. And the easiest way to do that is to pop the leg up, slide your knee underneath their thigh, keeping the legs next to each other. We don't want them to come apart because it'll change the load through the tissue. And then we're going to move that foot down towards the glutes. The key problem that seems to happen when people do this technique is the pelvis tends to want to roll. So particularly if you've got a really tight rec fem on that side, what will happen is the hip will want to pop up and roll across to the opposite side. So the key thing we need to do here is grab hold of that pelvis and stabilize it back down. So I'm going to reach across the pelvis to the other side, hold onto that, and then using my elbow onto this side of the pelvis, pull it back down and compress that down towards the table. We want a neutral pelvis position. The other thing that does is by keeping that pelvis down, it stops the pelvis from tilting forward or anteriorly rotating, jamming up the facets in the lower back. Many of you will have tried this technique and your clients will often complain of lower back pain during the stretch. The reason being is the pelvis is anteriorly tilting and jamming up the facets, so this is how we can lock it down. So pulling that across, drop the elbow down, hold the pelvis in position. We then take that foot towards the glutes, take up the tension on the tissue, and then from there you can either ask the client to try to extend their knee or push their knee down towards the table, basically squashing your knee into the table. You can do both of those things together or one or the other. Okay, so I'm going to get you to push your knee down into the table in this case. You hold that position and he relaxes, and then I can take that foot further towards the glutes, adding a little bit more tension to that rec fem. And then again we can push again into that. And relax. And then again taking it to the new point of bind. Moving bit by bit, increasing the length of that tissue as you go. And that's how we can apply MET to rec fem very easily with the client in prone.